Everyone to our seminar series curated by the Department of Health, Aging and Society. My name is Lauren, and I'm one of the Health, Aging and Society grad student reps. Before I pass things along to Dr. Grignon to introduce our speaker, I'd like to begin with a land acknowledgement and go from there. So we will take a moment to reflect upon the lands in which we find ourselves. We want to honor and give thanks to the Haudenosaunee and Anishinaabe nations as the traditional inhabitants of the land where McMaster stands. We recognize that we are guests on the territory where we currently have the privilege to study, live, and work. It is important to acknowledge the original inhabitants and the relationship they continue to share with the land. Acknowledging that not all people may be joining us from McMaster, we would like to extend this acknowledgement to all lands across Turtle Island. We need to recognize our collective responsibility as guests to respect and honor the intimate relationship Indigenous peoples have to land across Turtle Island. We honor and respect the sacrifices of all Indigenous nations, which allow us to gather and learn from one another. So we'd like to welcome Dr. Michelle Grignon, Department Chair of the Department of Health, Aging and Society, and introduce Dr. Bungie.
Thank you very much, Lauren. And it's my great pleasure to welcome and introduce Dr. Vicky Bungie, she's professor with the School of Nursing at the University of British Columbia and a Canada Research Chair in Gender Equity and Community Engagement. Dr. Bungie's research focuses on addressing inequities that affect people's health and well-being, in particular, the devastating effects of stigma, discrimination, and violence. She is interested in how research partnerships can positively impact communities that are regularly excluded in health and social policy and programming that affect their lives, and how community-based interventions support real-world evidence. She's also the scientific director of the Capacity Research Unit at UBC, which is a multisectoral and interdisciplinary hub where her current research and partnerships are tackling such issues as research ethics in practice, gender-based violence, and community leadership and health and social care reform. So I'm not going to steal your thunder and tell what you are going to talk about, just to mention that it's about community-based participatory research, And so welcome. Thank you very much for joining us and for giving this presentation today for the HAS talks. And yeah, the floor is yours. Thank you very much.
Thank you. Thanks so much. I'm just going to share my screen here to ensure that people can see it. How is that? Can people see that okay?
Yeah, very good. Thank you.
Okay, great. Thank you. Well, thanks everybody, and thanks for that warm welcome and invitation, and the invitation to be here. It's always great to get together and talk with people. So, as you can see from the title, we're going to talk about engaging with participation and knowledge and power in the context of community-based participatory research. And how we do this in intervention research specifically. And before we do, I just would like to also acknowledge the Indigenous lands and territories where I'm coming from today. And I am coming to you from the traditional, ancestral, and unceded territory of the Musqueam. And also that our research that I'm talking about takes place not only in the Musqueam territory, but also with the Squamish and Tsleil-Waututh, and in the Silk Nation of the Okanagan and their peoples. And it was great. It's with great gratitude that I'm able to be here and to work and learn and play. And in the spirit of understanding who we are, and particularly when we think about community-based research, I'd also like to acknowledge the territory of my childhood and give great gratitude for the teaching and learning that happened, being able to grow up in the unceded territory of the Mi'kmaq, and particularly the what's called the Unamakai, and I know I'm not pronouncing it right, I practice it, which is the island of the fog, or as we call it today, Cape Breton Island. So, and these things are important for us to acknowledge, because it's through the land and through our experiences that we come to understand how we came to be here as settlers, and also our commitment to equity and justice when we are working in the context of reconciliation. So I am going to spend some time sharing with you the experiences of myself and a complex team of people who I feel very grateful to get to work with on a regular basis, and talk a bit about a project that we've been involved in terms of how do we really work together to come together and really do this kind of meaningful inclusion and engagement, and design studies that are useful and valuable for the program, for the communities in which we're in, and for the programs in which there are activities already happening to support women, and particularly in this context, women in their community. So in the good teacher approach, we're going to talk a little bit about community-based participatory research, and then get into really kind of use an example and multiple examples to kind of talk about how to build a partnership, how do we grapple with knowledge and the hierarchies of knowledge in this thing we call science, and in the research vein, how do we think about the values and principles that underpin the kind of research that we do, and how do we use those to actually come together, work together, and actually develop an intervention research study that we can move forward together on in those kinds of things. So that's kind of what's on the agenda, and I'm watching time so that we have time to have conversations and all those kinds of things. So community-based participatory research isn't new. It's been around for a long time, and it's really important to us, and I guess, and why it matters is that we know that interventions, be they public health initiatives, be they social care initiatives, when they embrace community engagement, it increases the likelihood of a more positive effect for the community overall, and in particular for an array of health concerns. And we know that because it attends to the context of the community in which these kinds of interventions are happening. And community-based participatory research is a respectful and appropriate approach to community engagement in this endeavor that we call research. And it's valuable because it requires a commitment to identifying community priorities, research that attends to the socio-historical context, and shared decision-making. And it attends to power in all phases of research design, implementation, and knowledge mobilization. And that's really kind of what we're going to dig into in more concrete ways about. We all know that there are many challenges in undertaking community-based participatory research, and a lot of it has to do with how power and privilege and strengths and abilities all come into play together to allow us to come together and work together. The other wonderful thing about community-based research, and thinking about it in terms of an outreach intervention, specifically in a community where people are experiencing significant structural disadvantage through poverty and through racism and ableism, homophobia, sexism, and it gives us a grounding because it has a commitment to social justice and it has a commitment to equity. It actually helps inform how we take up our moral aim as researchers who are publicly funded to do the kind of work that we do, and how we actually enable ourselves to engage with some of those really pressing social and health problems that many communities are facing and also navigating on an everyday basis. So why do we need it in this particular context? So I'm going to talk and share the experiences of developing an intervention that was specifically related to engaging with women who are experiencing street involvement, and using that term kind of as a general term to talk about people who are living on or near the street, in some ways people who experience a great deal of public visibility and often are on the severe end of the scale for inequities in health and social care, as well as are often targets of criminalization that actually are things that people engage in to survive on a daily basis. And so the reason community-based research helps with us is that in our context, where we were working with women experiencing gender-based violence, and in this context of street involvement, we know that there's a lot of research, and we also know that research is really challenged at times to ensure meaningful and appropriate inclusion to determine research priorities and study designs. We know that there is a growing and increasing mistrust in research that occurs in many communities, and that this is embedded in harms that research has contributed to, most often completely unintentional, but the harm that can happen when research comes in and studies and then comes out. And there's lots of work to support how those kinds of harms get constructed, and the transactional approach that can happen in context of severe poverty with regards to research. And there's also a trend. We've had this problem for many of us who do research, is that we know that we have to illustrate and help articulate what the challenges are and the problems are, but it has contributed to a lot of framing for communities as from a deficit model or a damaged model. And there's incredible growth and movement that can happen when we kind of turn that upside down and think about what are the things that are contributing to harms, and also what are the strengths and capacities, and how we then engage with people who are in the communities that we're working with. And so the other piece that is so great about community-based research and the opportunity to do a session like this and talk with people and share with people is that one of the things that happens is there's training, but it's not consistent training, or we're all struggling with how to do this in the most ethical and meaningful kind of way, and enjoying it and embracing it. But it's through this process of how we're learning collaboratively to do this work and reflecting on these experiences, it helps us to explore what's possible and what can be achieved in the nature of these community academic relationships and overall for the community's well-being. So this study, which is called, part of it was called the Strength Project. It was a study that was designed to, it was a pilot study. So we were looking at acceptability and feasibility of an outreach intervention with the aims of building trust and sustaining relationships between the outreach teams and women who are experiencing street involvement. So building relationships and doing that in such a way to enhance women's capacities to engage with health and social care programming and services that exist in their community. And it became a really important kind of project that was designed specifically from consultation that community service organizations did with the women they served about the need for this kind of a program to better engage women in a more trauma-informed, safe, and also strength-based kind of way. And just to give a bit of context, I'm going to talk specifically to one area of the study that's happened in the Downtown East Side, is that the Downtown East Side community in Vancouver has become internationally known for its gender-based violence and ongoing structural violence. And currently, we're grappling with, and have been for a very long time, a drug poisoning crisis, and that our continued drug toxicity and the death of people in this community continues to rise. There's siloed service models. So anybody who's worked in the Downtown East Side knows that there's bajillion services and organizations and different kinds of things, but it is an incredible challenge for people to try and navigate a very siloed model. And because the siloed model creates a different way of thinking about women's health and their health concerns by constructing things again through a kind of illness sort of frame and model. We know that the evidence is quite extensive, that there is an incredible problem of discrimination that happens in health and social care. And that's not to say that health and social care is always discriminatory or is always problematic, but that those experiences contribute to a cumulative kind of response for women where the fear of engaging in something that is incredibly harmful and discriminatory creates both a barrier to receiving appropriate and timely care and a reluctance to engage. And we see this as it pans out for women with the rising rates of emergency department admissions as women wait, and women have no choice then until they're in crisis to engage with some services. In all of that, this is also an incredibly creative and resourceful community that through grassroots activism and the not-for-profit sectors in particular have created an incredible place for people to come together, work together, and strategize about how to create a community and the structures within it that fosters people's safety, health, and well-being, and helps them achieve their hopes and desires and wishes for their life. So at the end of all that is that in reflecting on the siloed way that things were happening, the loss of women in care, the inability to engage and retain women in care, and the ongoing health inequities that include significant violence, trauma, and also in the recent past and also throughout time and probably continuing. This is a breeding ground for serial killers that have come in to target this particular neighborhood in a very particular kind of way. And so the organizations and the women said there are so many women who are not well engaged, who are doing their best in every day to survive and to live their lives as fully as possible, but we need a new way and a different way that is more respectful and strength-based and credible and responsive to engage women. And so that's where this came from. And so the idea for this kind of project and how it came to be and how we ended up in this community-based kind of process was that, sorry, that's an accident slide, is that the organizations, primarily the Inner City Women's Initiative Society, which has a long-standing history of serving women who are not well served in other health and social care services, worked with their clients to really identify that this was a problem and that they needed help to articulate the problem more clearly to the public sector and to illustrate, study and illustrate how a different way of doing outreach and a different way of engaging with women could actually improve relationships with women and support their engagement with essential health and social care that was necessary for their overall well-being. So in that, how this all happened is I got a phone call, which is always wonderful as a researcher. There's nothing better than when someone picks up the phone and says, I need to talk to you about an idea that we're having in our community. And I had worked in the community as a nurse, and I had been involved in a lot of different things over the course of my career. And so the first thing we did was get together and decide that we needed to build a really strong team for this to move forward. And this slide that we have this was our best guess. And so it started out with Inner City Women's and UBC School of Nursing, and Linda and I, and then it moved into who are the other organizations that we need to work with that can keep this small and manageable, but we needed support in child welfare, family welfare, legal advocacy, as well as health and social care more broadly. And so we put together this kind of team that started with who are the organizations that should be in the sandbox, and how do we have conversations? And so we did consultations and worked with them, and invited other people from different organizations to participate who had leadership and practice backgrounds. And we also, and I'm going to go into the community advisory in more detail in just a minute, we also recognized that we needed researchers who had experience in pilot intervention and who were informed in what really is needed to do kind of trauma-informed research, and had experience working particularly at this level of kind of structural disadvantage and the severity of the violence and trauma that women were experiencing. So we thought we'd have this kind of, I call it this leadership team. We'd have this core group, and we'd have these advisory groups, and we worked really hard to put it all together. And what happened in this was it evolved to be sort of this kind of central group around researchers who could talk and share and come together, as well as this incredible community advisory committee that was constructed to really support that this work be meaningful for the community, and also could help to ensure that we adhere to the principles of community-based research, that we had to have authentic engagement, we had to have meaningful inclusion, and it had to be in a way where the experiential experts of women who live in the community and have experienced health and social care could really guide, direct, and be foundational to how the work was constructed. And what was really interesting about this particular advisory is it evolved and developed in such a way that the community service organizations constructed the advisory committee by identifying and inviting women in community to explore the possibility of coming together. Anybody who was primarily a researcher stayed out of that process. And this advisory committee, which ended up being comprised of, on any given day, 4 women. We had 6 women, and then 4 who consistently kind of stayed, as well as a service leader and a support worker, worked together to really build the team and decide together what their role would be in the project. And once they had come together to ensure that they could function as a team, that they had clear strategies to support trust and safety in their engagement in research, and also to have a fair way of remunerating their time, and ensuring that as their lives were unfolding and any support needs that they needed were also provided. Once they had all of that kind of together, then the researchers were invited in, by which we could then come to work together to really move through and focus on what it is that this project was going to be about, and how we were going to make this happen in the real world. And this slide is a snapshot of this study was occurred sort of through 2017 and 2020, and I'll wrap up with where we are today at the end. But we really, this advisory committee, you can see here that the activities were, learning to work together. They were integral to how we constructed the outreach teams, how we did measurement, all of our metrics, how we defined the project, how all of those things. And what was at the core of it was how it was tailored, how we were going to tailor this intervention in a very safe and respectful and appropriate way to the actual the setting that we were working in. And I'll go through the other pieces on the sort of right hand of the slide in a little bit, but it was through working together collaboratively between these service providers, leaders, researchers, and the advisory committee that we really were able to begin to work to figure out what this thing was going to be that we were doing. So our next step was that we needed to define what we meant by outreach. We know that there's 1,000,001 different definitions and different ways of doing it, but we wanted to know we wanted to know what the evidence was in terms of research evidence. And we also wanted to understand what was happening on the ground and how are we going to mesh all this together as we were working together to figure this out. And there's this beautiful phrase called epistemological flexibility, which really was the essence of coming together to work together to define outreach. And in one of the things that often happens is that, you know, we have this kind of thing where, okay, this science is, you know, this type of knowledge is the best knowledge, or this kind of knowledge needs to be the best knowledge. And what we really grappled with was actually, how do we value all of the multiple sources of knowledge that are necessary? And how do we ensure that we can kind of challenge the hierarchy of how certain things are come to be known, or in a way where it's not just the scientific method, but there is so many other pieces of knowledge, the subjective, the experiential, that are so essential to being able to do something effective in community. And so this was our challenge. And so what we did was we had this very iterative approach to how we were going to define it. We did, as you can see here, we did a scoping review. We developed a protocol and did a scoping review of kind of the best practices and measurement around outreach that existed in the literature. And we fed that back in terms of discussion with the community advisory members to privilege the experiential piece and see how that lined up or didn't line up, what was good, what was bad. And as we were doing that, we also came to realize that we needed more knowledge of what was happening on the ground from the providers' perspectives, and did a series of interviews with outreach workers in 6 different programs. And together we pulled it all together, we hashed it all out, went back and forth, and stayed committed to the fact that we really wanted an intervention that would privilege women's autonomy and their strength. And we were able to construct kind of this definition of outreach, which continues to evolve to this day. But that outreach is it's a relational practice, it's about engagement, and it has as its core, it's tackling those structural barriers to care that negate the ability for people to attend to care, or have the care that they need when they do attend. And so we were really looking at, how do we foster safe spaces? How do we foster this kind of ability for people to engage with the system in a more safe and meaningful way? We knew that outreach would be effective, and it had to include practices that started from women's strengths and capacities and continued to build on those over time, and that it was never a one and done, unless that's particularly what a woman wanted. It was about, how do we start to build relationships so that the outreach program can build and sustain relationships with women over time, because as women start to engage with health and social care, new goals and new needs arise, and ensuring that this program was able to sustain engagement over a period of time, depending on what women needed and what they wanted in that kind of context. So we had, as I said, these kind of core values, because we are grounded in the work of gender-based violence and understanding what that means. We also recognize that the women that we work with are all at varying points of healing trajectories that are associated with trauma and violence, and that this intervention program would engage at any point along her trajectory. So it was important that we didn't create a silo or create a restriction, but it was about whatever and wherever a woman was, that we could connect and start to build a relationship. And just to put it in that context, our approach to women as a gender location was fluid and inclusive, and it was for anyone who self-identified at any point in time with engaging with women-specific services or as a woman for their purpose of interacting with us. So once we did this, so now you see this happening. We've got a team, we've got our definitions, and then we really grappled with what are the core principles and assumptions that really need to underpin this, and how do we talk about them, and how do we articulate them so that when we design the intervention, they're embedded. And so this was this is an example of all the different kinds of principles, or guiding principles, many of which are interrelated, that guided our work. And we kind of synthesized them into 4 main areas. And one is that how we're tackling gender-based violence is a huge piece of this, recognizing that gender is relational, and that gender-based violence is situated in this larger structural context of the acts and practices and policies that are harmful, that are directed at an individual based on their gender. And we also recognize that gender-based violence occurs because of these patriarchal notions of what is feminine, and that is subordinate in the context of women and girls, and for many gender diverse people, that this concept of feminine is a subordinate position in society. And that what that meant for us was really thinking about how, when we engage with women and we are thinking about the services that they're going to engage with, how those patriarchal and colonizing ideologies actually influence women's health, and how those services are organized, and what we could do to mitigate those harms within that context. We also took, was very clear to us that we needed to grapple with relational engagement and personhood, and this idea of that outreach is relational. And as I noted before, we really wanted to get out of the ideologies of damage or victim that create a limited view of a woman, be it as a woman is either a problem or a practice, and we really wanted to get out of that. And that we recognize that all of us come with histories and experiences and relations that can influence our actions, and these can be supportive or prohibitive in how we build relationships, but that at the core of this relational piece was the valuing of the individual, of who they are, their hopes, their dreams, desires, capacities, and that including who the outreach workers are and what they bring. And that through these acts of respect and reciprocity and rights to self-determination, that we could start to build these kinds of relationships. And through reciprocity, we're talking about mutual recognition of one another as having basic value and our basic humanity, and what we will co-learn in our benefits and contributions together. Women-led, in that we didn't create, women who experience HIV or women who are experiencing, homelessness. It was who are the women who we're working with, that we're, engaging with out and about, and what it is that they would see as their priorities, and what is it what they would like to work together on, be it an emergency, immediate crisis, be it housing, be it all these other things. And that we would start from a place of strength versus deficit, that women are already incredibly skilled at navigating and processing what's happening. Our other principle in this kind of way was we really grappled with what trauma-informed means. And I intentionally used trauma-informed engagement versus trauma-informed care to acknowledge that we've kind of, I'll say we've adopted some things from trauma-informed care or trauma violence-informed care, but we've also tried to grapple a bit with what a lot of that work does in kind of creating this, care provider versus and woman as instead of that shared kind of personhood and how they come together. But what we did do in drawing on a lot of this work was it really helped us to understand trauma, because one of the core things is that recognizing that trauma is what it is in terms of how it's the experiences and responses that's associated with events, that it's not limited to the individual or a psychological effect, not recognizing that occurs, but it's at the intersection as well at the structural causes, and that it contributes to significant marginalization and inequities in health and healthcare. And it's that intersection of those kinds of things that were really important in how we understood trauma, both as experienced, but also how kept us thinking about the causes, always in our mind about how and why trauma occurs, and what's our role in engaging with that. It also was about grappling with reciprocity and personhood. As I said, we didn't want to perpetuate any pathologizing of women, We didn't, and I, you can hear me, I'm over and over again, this idea of a damaged and victim. And we really grapple and still grapple with what is the mutuality of the relationship, and what people, both women, outreach teams, and services have to contribute within the context of care and engagement. And at the core of all of this is building trust and safety, and safety being, thinking about cultural safety, not so much about where everybody's from, but in the context of creating a program that was safe and appropriate and non-traumatizing for people, that could meet people where they were at and could work with them over time to build trust that we would continue to be a safe space in which to engage and work. And our kind of last kind of core principle is harm reduction. We know the intersection between trauma and substance use. We know the intersection between street involvement and substance use. And so we really wanted to identify that how the harms associated with structural disadvantage, and that it's not just harms at the kind of level of the individual, but that many of the harms that are associated with substance use are also tied to these bigger factors in the world that create inequities for people in terms of how they can use safely, and their options for, should they so be ready or desire, their options to engage with treatment or counseling and all those kinds of things. We also, in our principle of harm reduction, avoid the silo approach of infectious disease or overdose. We took a more comprehensive, or the binary of harm reduction versus recovery that is rampant right now, and instead looking at what is harm reduction as a means of engagement, drawing on the grassroots activism. That is where harm reduction started long before we in public health got our fingers into it, where it really was about connecting with other people in their community, supporting people to be safe, and starting to build relationships for people to grow in their possibility to engage, have social connections, and their overall well-being. So, so all of that, I realized I could talk for hours and hours on this because there's a million different things that went on, is we actually got to this point where all of those pieces, thinking about the principles and the back and forth, and that everybody's working together, and it's not a one and done, and we're still working in back and forth to all these kinds of things, but really engaging as a team, engaging with the advisory, engaging with clinical leaders, engaging with researchers, how we could take all of these understandings, design these principles together in such a way to create something, which is what we did. And we created this 18-month intervention that had kind of two core elements. One was about making connections, and that was about developing the credibility of the team, growing the team, providing the training support for the team to be able to put those principles into practice. And a lot of that involved being just out and about in community, providing immediate and short-term support, where that was unconditional, and where respect and safety were prioritized. And in that context, we worked and took a lot of leadership and guidance from advisory members and community health workers who, in other contexts, might be referred to as peers, who really guided and provided the essential training of what safe engagement looks like for women. And as over time, as we moved into this, as we're meeting women, this element too, where you're really starting to make connections and linkages, and developing a relationship for sustained engagement, to be able to really work one-on-one in some ways with the women to explore their hopes and goals and needs, be they very short and immediate, be they short-term or longer-term, such as everything from, wanting to re-engage with their children who had been taken into care, to trauma counseling, to detox and recovery, and just and to employment, and just kind of thinking about starting at that place of short-term, building a relationship, building trust, and being able to grow into these longer-term kind of engagements, but never requiring that women had to go there, but staying connected and supporting women where they were and what they were ready for, and helping to draw on their strength and capacity as they were moving along. So I will very quickly do this. So there's a whole report on the findings, and we're still writing them up, but the greatest thing about this design and the deep commitment to those principles and the learning that we have when we take the data back and work with community to kind of do all these things is this has enabled us to, as a team, define what we consider trust and develop trust as the primary outcome of any program that provides health and social care. I'm not saying everybody has to do that, but this is how we've positioned it, to really come up with these core elements of trust and know that any engagement requires permission. And permission is negotiated. It happens over time, but really negotiating that permission to engage with women as an outreach worker, and then every time you engage, permission to where are you today and what will work and what won't. And then by doing that, being committed, consistent, having good boundaries, respecting privacy and confidentiality, and this idea of doing with and not for, that allows for trust, that can build relationships that can stay over time. And we modified our guiding principles to kind of really start to nuance out, what do we mean by a strength-based approach? What do we mean by reciprocity? And I have the resource link for this report and those kinds of things. And it's also the fun part of all of this is it's all been fun. It's all been amazing. It's led to a new study to scale up and adapt the kind of work that we're doing in a variety of contexts across Canada and with a variety of people, and women and girls in particular. And really looking at how can we adapt this model in different contexts and implement it to, again, reach those folks who are not well served in different ways, and support that people have the opportunity to grow and direct the kind of services and care, and also to study the process while we're doing it to know what's working and what's not. I'll give a nod to all the fabulous people that we get to work with across 4 sites, and we're in various phases of rolling this out and adaptation, and that we've refined, really what we mean by making connections, and really what that initial and how we strengthen them, and thinking about people who have not been engaged at all or really unable to engage for a variety of reasons, or reluctant, or the services don't exist, how we start with recognizing that in the street involved context, people are often in crisis, and that how do we respond in crisis and then develop relationships over time to be able to get into this reciprocal and respectful ongoing relationship that can really foster trust and support women experiencing violence and mitigate some of the harms that happens. We are, I give a huge shout out and thank you to all of our partners, people who make this work. And I'm just realizing I did something to the slide. So Rise with Legal Women's Center is sitting up there on top, but it's another partner in Vancouver. And to the people, we have so many people, and the advisory members, some of whom we've lost, and the new ones who come on. But this is our team and our funders that are helping us think about how we can use all of these community-based approaches in ethical and meaningful kind of ways to be able to do this kind of work, and see if we can do it in other settings, drawing on this kind of how we really negotiate and build capacity to do these partnerships together. And I'll stop there and say thank you. We've got some contact information that I know that's to be shared. And as I said, there's some resources here that we can share with everybody in terms of access to the scoping review, the community report, and some of the some of the folks who are thinking and writing in this work. And if you haven't read Eve Tuck's work on suspending damages, I highly, highly recommend that as a great kind of way to kind of think about how we grapple with the damage, sort of the damaged and deficit narrative. And I'll stop there. Thank you so much. And we'll open it to questions. I'm going to stop sharing so I can see everybody. Is that okay?
Absolutely. Wow, Vicky, that was fantastic. Thank you so much. And yes, absolutely. If there are any comments, questions that anyone wants to bring up, you can let me know and either type them in chat or just unmute, I suppose. We're a relatively small group, so I think it's fine if folks just want to unmute and go ahead. Well, maybe I'll abuse my power as moderator and go first while folks are collecting their thoughts. So I was really excited towards the end when you talked about the research to look into scaling this up and adapting it, because as I was listening to you describe your work, and I was just thinking, this is something special, right? And so the urge is you want to bottle it, you want to turn it into a silver bullet. And I think that's a pitfall that we have a lot of times, not just with community-based research, but with public policy in general, trying to over-apply and over kind of saturate, one particular approach. And so given that this is such an engagement-focused process, right, that's iterative and it's constantly evolving, you talked about negotiating permission always as you're going through these kinds of things. I'd imagine that it would be rather difficult to scale up in many contexts, and that when you're trying to scale up, there's this urge to want to streamline, to want to make things more efficient. So I guess I'd love to hear your thoughts a little bit more about how with community-based projects like this, you can achieve that scale up without, I suppose, turning it into a sort of a cookie cutter process that loses some of the engagement focus.
Oh, thanks. That's a great question. I wish we had 5 more hours. No, it's it is one of the greatest challenges, right? We have this thing around generalizability, applicability, and I could go on about does that really work? But what we have learned is that if you take the time to really understand the context, do some context, so what's happening in that community, like what kinds of services are provided, what's happening from the perspective of women, or and I'll use this context, and we have youth in some of those other sites and gender diversity in different ways. But if you take that time, and it doesn't take, like we think it would take forever and ever, but in like 2 to 3 months, you can do some really intensive kind of engagement with organizations and their clients, and really have this kind of like, what is the context, what's happening here, what kind of services exist, and that allows then for a greater conversation about, given that we have this kind of, you think about outreach as, building connections and supports and those kinds of things, with whom would this be beneficial, and how would we do it, and what if we stick true to the aims and the goals, how do we adapt and modify it so that it is something that can happen? So it's definitely not a cookie cutter, but we actually have developed kind of a protocol out of our learning with this for what are some of the things you need to do before you could implement this, because you can't implement it exactly. So in the context of street involvement, as we're moving with other sites, who are very much interested in because of the way that the services and that they provide around sexual assault and intimate partner violence, what would this look like in that context? And recognizing that people might be experiencing street involvement, but that the people coming in through their doors are coming in or not coming in through their doors are given, that's that's what's happening in that community that is creating havoc for people. And so how then would we use those core principles to think about outreach as a means of engagement, and what activities would an outreach will look different? But the metric around is this a trusting program? Are we able to build a relationship? Are we able to sustain engagement with women or people over time? Those things stay the same, but it gets, because it's about the trustworthiness of the program versus, that kind of thing, and how people perceive of it. So yeah, we've got a whole strategy called implementation readiness, to use good, research language, around how you get ready in a community to do this kind of work. And it's built into the partnership grant. And we didn't know we needed to do that. I will tell you, like, we kind of knew we needed to do that. And then COVID hit. And what COVID did was it changed the whole landscape of gender-based violence in this country and across the globe. And it highlighted just not only the prevalence and the problem, but all of the factors that contribute to it. And so we're working around, given where you're at, the context is different, how those factors play out. How does research engage in that particular kind of way, and how does outreach? So yeah, it's a long-winded answer to say you need to do the homework, and you need to build the understanding of what's happening there and how this can be useful. And it happens quick. There's people here that could tell you, I see people on the call that I've been working with, that it doesn't need to be, we've learned a lot. And communities already know. See, it's a researcher that has to catch up. For me, that's the thing, is that they know, and then what's the possibility? What's the unique thing that research can bring to help put this into practice in that setting? And we bring metrics, and we bring a way to capture the evidence, and to be able to package that for their funders and their, all of the people who could potentially influence and improve those services within their organizations and their communities. Long-winded answer, but thank you. It's a great question. It's something we're grappling with all the time. So thank you.
No, great answer. Thank you so much. And so I'm just scanning for folks who may have a question, or I did see a comment as well in the chat. So thanks for sending that in.
I've never known people to be this quiet. So it's just people are thinking. I've either given you something to think about or confused you. It's either.
Well, no, I think there's a lot to think about for sure.
I just wanted, it's Shaheen. It's so wonderful to just really hear out, the specifics of this work, and just really hear more about, what it means to work outside of a deficit model. Because I think as researchers, we're very immersed unknowingly within deficit models, and to actually hear what it means to work outside of that. And so I put that in the comment, is just really further deepening that understanding of what strength-based work is, and how you and the team and the whole group are working for women, and not making sure that they're not defined by their context. So I think that really struck me. So thank you.
Thank you. Yeah, we are funded, right? Research is funded because we are funded to address problems. And so it's that balance of how do you articulate, because these are very real problems, but how do you articulate, how do you position people within those problems is something we always strive to do.
Michelle, I believe you had a comment or a question as well.
Yeah, it's a question, and it's okay. I'm an economist, so I'm from the epistemologically rigid side of the world, and I have a question for you, which has to do with community engaged research in general. I was the evaluator on a project, and the project involved at one point quantitative survey, and the project had a community advisory council or something. And at one point, I made some recommendations on the questions of the survey. I said, well, no, you cannot ask a question like this, like that, because it's not going to work, simply. And the researchers pushed back and they told me, sorry, but we cannot change anything because the community advisory council told us that that's the way it had to be. So of course, but that was the end of the story. I quit because there was no role for me as an evaluator. See, if the answer was always, we cannot change anything because the community decided like that. But then what's your take on that? How do we reconcile the, and I appreciate, maybe they can say, the community can say, we don't care about your expertise. That's not our problem, but still, my concern was that with the questions they wanted to ask were just, they would not get any useful or meaningful information with that kind of question. So how do you balance both? You want to respect the community for sure, but the community, they are not experts. That's okay, that's fine. But at one point, you have to have some expertise to do some things.
Yeah, it's a great question, and it's a struggle. And to be really honest, in many ways, it's a struggle. One of the things that I think is so valuable is that, I don't know if you had the opportunity, right, to present this to community versus the researchers told you no, right? So one of the things that we have found really, really important and valuable is to have an understanding of why, like what it is that we can capture in what kind of content, and what's the value of capturing that information, and then having a dialogue about how do we best capture that, and bringing in people who have really a lot of experience in capturing that. And then how do we capture that in a safe and constructive way? So for example, in this project, we were wondering if we should capture certain things around, social support and social capital and those, and the community advisory said these questions they make us really sad because we're really isolated and alone. And so we're really concerned that these questions, some of them around social support, are going to be really, they'll be really problematic for women in our community. But we also know that isolation and violence go hand in, when people are isolated, their violence elevates. So what we did was we had a lot of conversation around, we presented to the team, these are multiple different measures. This is the rationale of these measures. Are what of this is would you see as valuable, and what of this would be, and we brought in people that could speak to those in a very clear way, and then we had a very frank discussion. And then what are we going to do with that information, and how will the question was asked, what are you going to do with that information, and how will this information be valuable to our community? And we were able to articulate that by illustrating the degree of social support, or understanding the social relationships that women had that were beneficial to them versus those that we could then create different programming and different supports that we could actually augment women's social support. And we did. We have another project that's all about social engagement and that kind of thing. So one of the things is that in initial conversation, that building that relationship with the advisory, is we really work to understand the different expertise in the room, and what the different people. So what could I bring as a scientist and as a nurse, like what was in my scope and understanding, and what was in theirs, and our commitment was to how do we bridge them. And we had frank conversations. I'm like, yeah, we're going to need to do this, if we don't do this, you know, we're going to have trouble with the funders, or we're going to have trouble pitching this to policy. And so let's talk about how to do this in the most meaningful and safe way. And we created a huge protocol around how to do data collection to support people in the process of doing a survey with us or doing an interview. So we did it that way. And in this project, we've brought in, you know, because we appreciate the economists and the need to be able to you know, illustrate impact and that kind of thing, we have worked to illustrate how we can bring folks in to help us understand these and have time points and metrics along the way. But it's been about ensuring that the people who have that knowledge that can contribute get to have that chance to build a relationship with the advisory as well. And then we grow out from there. That, to be really honest, was like, we went around and around. Like, we were, you know, we didn't want to measure violence, right? Like, we know what the violence is. We've got all kinds of, but we knew we needed to talk about safety. And so how do we construct questions about safety in a safe way? And, you know, and why that matters. And it was mostly about, you know, this won't work. If you ask this, people won't answer. This is the problem with research in the community. We really listened to what they had to say about, I mean, the downtown east side is an industry of research, right? A lot of people are very savvy in as participants, and this is the kind we want to do. And so I will say this in a really, you know, not a utopian, because it's hard work, you know, but everybody got their cookies. Everybody got what they needed in terms of the information, and then how we package that information. So it can happen. You got to get in the room. That's my, you know, and people have to let you in the room, right? So we would pitch to the advisory. This is somebody we would like who wants to come and talk about this. This is what they're going to do. Would you be willing to invite them? And we never had a no. We never had a, you know, like, it's just that kind of capacity. And we had no's on, you know, and lots of intense discussion. And, you know, it's not easy, but we got somewhere really solid. And people are reflecting on what we didn't get because we couldn't come to agreement. And now we're fixing that in this study. But everybody understands we don't have that data. We didn't ask this, so we can't do anything with that. And how do we do that this time? So it's a long, I know it's hard. It's hard, yeah. But you got, like, there's, you know, my experience is people want to know why and how you're going to use the information, and that changes the dialogue. That's been mine, but.
Great. So, Dr. Bungi, I'm just noticing that we are a little over time, and as much as I don't want to be a party pooper, I also want to make sure that I'm respecting your time. So we do have one other question in chat. Are you game to answer this one last question, and then we'll wrap things up and maybe continue?
Yeah, and I'll be quick.
Perhaps
I will be quick because I'm going to email. There's emails on there, and I am going to teach, so I will. I'm going to class. So how do we get more people to get involved in this? That is a great question. And one of the things I will take this message from community is that we need a safe way for community members to be able to talk about and illustrate the importance of the work. And I think that is at the cornerstone of how we can do this. We need the teams that are doing this kind of thing to be able to come together, but we need a really safe way for the community to be able to speak up and be part of that. And, you know, there's all kinds of other ways, you know, there's training resources and all those kinds of things. But at the end of the day, it's about what are those core principles and values that you're taking into it, and how do we build this network so that people have the skills to be able to articulate those core values and work together as they move forward to do things. And so we can do it in school, we can do it in education, but we try and do it in policy, and it's really difficult at a policy table, but it is around one of the women that I work with said every day and every interaction should be an opportunity to articulate how important this is, and to articulate that you just take your opportunities where they are. And I think it's one of those things that you can't mandate, you can't, but it's about the pebble in the water and increasing our networks of the people who have this commitment, and the communities that want to do this, about increasing the networks of how we work together, because together, if we could, come together in our networks, it creates way more possibility. But it's, that's my very short answer, is reach out and find the people you want to play in the sandbox with, and grow your sandbox, because there's so many people that have expertise that we need in our work, but we always say, oh, they're this, or they don't have, I'm just thinking of Michael, or, oh, if you have this, then they're saying no to you. Like, I'm just thinking of that, like we need their, I understand what the no's are, but what we really need to do is engage and have value for all of us and what we contribute, and just build the network. That is because remember, at the top of the heap is that a lot of the structural disadvantage is intentional, right? It reinforces these kind of oppressive practices, and all those kinds of things. So you got to build and grow in with your peeps and move it on out. That's my eloquent end to, solving a major problem. Find your peeps, play with them, and start to grow and find more. That's what
I think that's the perfect note to end on. I can't think of a better